Welcome back to the ACL Academy. This is Dr. Kaan. Today we are going to touch on ACL graft choices. So what are you going to use for your new ACL? Before I get into that, if you guys have found value in the page, please subscribe to the channel, like this video, and share with a friend. Spread the word. So when we're talking about ACL reconstruction, we are talking about replacing the native ACL ligament. So when it's torn, that area does not have great blood supply. Usually historically a repair is not possible, and it needs to be replaced. There are some new technologies coming out that we're starting to utilize for repair procedures. Having said that, the evidence is just not there yet. So currently we're still seeing a lot more reconstructions, which is replacing the native ACL versus repairs, which is basically taking the tear and repairing it. Okay, so when we're talking about reconstruction, well, we have to use something to replace it with. So what are the choices for your ACL reconstruction graft? There is an autograft, which is using your own tissue, and then there is allograft, which is using a cadaver or donor tissue from somewhere else. Really, the best choice has been autograft. There are multiple factors that go into this: age, activity level, sport you play, gender, to make a choice, as well as the surgeon you're using and what they have the most experience in replacing your ACL with. Now, when we're talking about autograft, as I said, in most cases, people going for this surgery, I will push for this type of graft because once studied, it shows the success rates are better, longevity is better. So for me, if I have an athlete, and an athlete that could be 15, 16 years old to an athlete that's 50 years old, if somebody is participating in high activity levels and a high volume of activity levels, for me, this is where I'm going to position them towards. So when we're talking about autograft, there are usually three choices that are utilized today: patella tendon graft, quad tendon graft, and hamstring graft. Okay, patella tendon and quad tendon are on the front of the knee, right? Patella tendon is below the kneecap. It starts on the shin. Quad tendon is just above the kneecap. Okay, hamstring, we use the inner portion of your hamstring muscle, tendon, that is. So we take two pieces of the tendon there, and that is also utilized. The patella tendon, hamstring tendon have been around for the longest, most widely studied, still utilized as a gold standard. Quad tendon is newer, but has also been studied and shown to be a reliable graft choice as well. So there's up and down science for either choice. When we're talking about quad and patella tendon grafts, there is a possibility of anterior knee pain or front of knee pain, especially as we're trying to work the quad muscle, as well as there's been some sensitivity to kneeling and being on that knee from those donor incisions. So those are the downsides there. With the hamstring graft, there are some studies that showed it can be a little bit more lax compared to the patella and quad, and also hamstring strength takes a big hit and can take a long time to get back, especially for our female athletes. When we're talking about cadaver grafts, plus side for this is it's quicker recovery times because we're not robbing a piece of our own tissue. So remember, when we're talking about the autograft, the stuff that I just touched on, we are basically taking a piece of healthy tissue and using that to replace our ACL. So when we take away that healthy tissue, well, there's a donor site there, and there are some after effects to that. So it does take some time for the body to heal. So we're essentially dealing with two injuries, two recovery process versus one. So there is some intricacies based on the graft choice that we use and the recovery process there. When we're talking about the allograft, where we're using a donor, well, we're not robbing any piece of our tissue. So we're only just dealing with the ACL recovery process. And because of that, the recovery process is a little smoother. The downside of the cadavers is sometimes our body rejects this graft, can lead to infections. And it's been studied that the longevity of these grafts are not as long duration-wise for comparatively to our autograft choices there. So these are the ones that you're going to see. My recommendation is once you go for your ACL consults, if you're deciding to have ACL surgery, you meet with 3 surgeons minimum. You talk to them about the choices that they like, why they like them. Also ask them what they do most of, because at the end of the day, if your doctor is a big believer in hamstring grafts and this is what they do, asking them to do a patella graft may not be the best thing because they may not have a ton of experience with that. So it is important that you do meet with a few different surgeons, you get a few different opinions on their beliefs, their thought choices, and you do your own homework. As I said, there are other factors that go into choosing a graft, such as your age. So if you're, let's say, if you're a high school athlete and you may have many years of activity level and high volume intense activity level, versus somebody who may be a little older in their 40s or 50s, but still very active and participates in different sports and activities. So this plays a factor. Male or female plays a factor. The volume of the sport you play is a factor versus is it once a week or is it 3-4 times a week, right? Is it 1 to 2 hours a week versus 10 hours a week? All this stuff will play a role, as well as the sport. So are you, let's say, a runner or hiker versus a skier or a soccer player, right? These all put different demands on the knee itself. So these are the things that you would talk to your surgeon about, that you would talk to your ACL specialist about before making a decision on graft choice there. So it's hard to say which exactly is the best graft. Having said that, there is probably, after doing some research and getting some opinions, there probably is a best graft choice for you. So I hope you guys found this helpful. If you do, please like the video. If you have any questions, drop a comment below. Please subscribe to the page and share with a friend. I'll see you next time here at the ACL Academy.